Welcome back. This is Ravi Anupindi. This is part two of the module on prevention, where we started discussing the COVID-19 testing scale-up challenges in the United States. Part one gave a diagnosis of the problems. In this part two, I'm going to speak a little bit about proposed frameworks to address the issue. Just a quick recap of the testing scenario from what we discussed in part one. So what we had was, remember the ecosystem comprised of the following entities: the labs, the manufacturers, the sample collection points, the general public, of course, the health professionals who authorize tests, and the coordination by state and federal governments. Just a quick, what we diagnosed in the part one of this session was the scale up of testing had been very, very challenging over the past several months. There seemed to be a breakdown of coordination across the various stakeholders in the ecosystem. Everybody was trying to do the right thing, well-meaning, but somehow overall coordination was breaking down. There was extreme fragmentation of information and actions across the whole network. And it seemed like we were not measuring the right things. For testing, the most important metric would be turnaround time, and there was very little attention being paid to measure that as a performance metric. So what to do? Before we propose specific solutions, I think as we looked into this stuff, to me, it reminded me that this is really a crisis of huge magnitude, but we don't want to be in a situation where the management of the crisis itself becomes a crisis. What I say is crisis management should not become a crisis. And that happens because we don't have the right structures. I always emphasize that structure drives behavior. And without the right structure, it doesn't matter. Well-meaning people want to do the right thing, but somehow you don't get the right outcomes. So that's what the notion of structure drives behavior is. So what do we mean by structure, and how do we kind of address that? So what it means is that we need to take a very systematic and process and supply chain oriented approach to looking at this stuff. We have to ensure that we capture the right information and in a timely fashion. We have to set the right structures and incentives, and I'll talk more about what I mean by that. And given the scale of the challenge that we are facing and the number of people that have to come together to address this, it is very important to develop visual dashboards. I truly believe in visual management techniques. So having visual dashboards to guide decision-making is extremely important. Let me then present, given these kind of basic ideas, let's see what kind of solutions can be proposed in this context. Let's start with visual management. And I think here is one type of dashboard that could be developed, and these are all suggested. None of these dashboards have been developed. These are proposed dashboards. This is the state of Michigan, and what we are showing here is the locations of different labs, where they are, but more importantly, to color code them as a traffic light system: low risk, moderate risk, and high risk, and identify what the important metrics are. What are the key performance indicators for each lab? And I would suggest that it has to be turnaround time. So a high-risk lab, for example, could be a turnaround time lab that is facing a turnaround time greater than 5 days, maybe has less than 5 days of supplies left before they'll run out and could do any tests, or there are some other urgent concerns reported by the lab. At the other extreme, low turnaround time could be labs that are taking less than 2 days, et cetera, et cetera. This gives a visual feel for managers to see where to focus attention. That is, I don't have to focus attention on all the labs. I can focus attention on the labs that are in the high risk category. And of course, this would be, you can get to lower level of granularity by clicking on any one of these labs and getting more information about what is happening at the lab, who to contact, etc. So visually, it represents what's happening. We can develop a similar tool for collection points. The metrics obviously will be slightly different, but still similar color coding scheme with traffic light system. But in addition, what one could overlay with is what you see here is these different tiled shades of blue color would be, for example, where the virus is spreading. So where the virus is spreading more, I need to ensure more collection sites available, or perhaps some kind of another index of population vulnerability. Do population have equitable access to the collection points? Visually, if you represent this stuff, I think it's just easy to see what's really going on. So this is visual dashboard for labs and collection points that can be done. Then we need to address the incentive issue. So we need to figure out a way to incentivize faster total turnaround time. It's not enough just to scale up capacity. The testing has to be done within a certain amount of time. So the total turnaround time of sample receipt to result reporting, if we can adjust the payment system based on turnaround time, firms respond to incentives. So we need to kind of look into that, whether how to change the incentives. The other stuff we talked about is there is a huge fragmentation of payment systems in the country. If we can standardize the payment mechanisms for COVID-19 tests to labs, that will mitigate any incentive misalignment and optimize lab capacity utilization. So I'm not getting different amounts of money depending on who the payer is. The other recommendation here is around investments. Some high capacity, high throughput labs require huge amounts of capital investments to make, and the capacity is so huge that it probably exceeds the total demand of any particular state. So there is value to multiple states coming together and pool their investments. In fact, this did happen later in the summer when our state of Michigan and 5 other states came together to commit to purchase 3.5 million tests. I just wish that had happened earlier in the crisis. So that is leading to investments in capacity. In terms of testing strategies, as the disease has progressed, there are many different types of testing, many different needs for testing. There's obviously diagnostic testing, there's testing for screening, there's testing for surveillance, etc. And there might be different types of testing types available. So a clear segmentation strategy to best match the purpose of the test and with the type of test that needs to be performed. The most constrained capacity has been RT-PCR diagnostic tests. To reduce turnaround time, we need to develop clear prioritization criteria for this scarce capacity. It's not enough to pass guidelines. We need to have appropriate mechanisms to ensure implementation of those guidelines with a prioritization strategy, segmentation strategy, and a traceability to ensure compliance. Another way to reduce volume of testing would be to do pooled samples, and this is a technique that people have proposed. And there are naive ways of pooling samples. There are smart ways of pooling samples to come up with good algorithms to kind of do the sampling. And the other thing that came about in this context was that state agencies, public health agencies are not supply chain experts. And yet a lot of the problem that was happening was supply chain related. And we have experts in the private sector who could step up and help. So creating a mechanism to leverage private sector personnel to help with managing the challenges of procurement and supply chain management becomes important. Finally, then you need to develop an overarching governance and coordination mechanism. This graphic looks a little bit busy, but I'll walk you through. At the state level, the COVID-19 test management team or senior leadership team, whatever you may call it, but then we need to have separate working groups because there are multitudes of issues that are going on. Labs have their own sets of issues, collection points have their own sets of issues, et cetera, et cetera. So what these are different tracks, and tracks, call it working groups or whatever. Each track, what we are showing is who the potential participants are and what issues are they going to analyze and discuss and report out on. So for example, in the labs case, we have lab directors, suppliers to labs, the public health representatives from the Michigan state, right? And they discuss, they can do capacity analysis, they can look at human resource issues, they can look at supply availability, et cetera, reporting issues, et cetera, and report out what the challenges are and what needs to be done. Similarly for collection points, similarly with working with manufacturers. The important idea also is demand. There has to be a track or working group that is focusing on not just where the current coverage gaps are, what are the reopening plans of businesses and institutions? How will that impact the demand for testing? What is the future capacity assessment? How is the disease progressing? A lot of different details need to be done. So for example, this could be staffed by public health experts, modelers, institutions, employers, et cetera, that can create these outputs. Obviously, this requires investment, so there needs to be a separate track that looks at budgeting and finance. Important piece would be health, behavior, and education. We can't get this done without proper, very clear behavioral messaging going out to public, to the employers and employees. And there is no point reinventing this wheel. If there was a track that came up with, that engaged with public health experts, employers, and public organizations, they could come up with standardized way of communicating. And similar in vein would be the communications about what's really going on, whether it is update to executives, to population, employees. Communication becomes an extremely important thing to manage during such crisis. So different tracks, all of these tracks could report out to this senior leadership team, and any coordination between tracks required could be orchestrated by the senior leadership team on an ad hoc basis. The other important thing is that these tracks will create outputs, but those outputs should also be used as much of visual progress tracking tools as possible. These are some suggested ones, whether it's bar charts or some other types of charts to show what's happening with the progress, whether it is turnaround times, whether it is demand issues, whether supply issues, etc. So again, as much as possible, use visual tools, and this is kind of having the overall architecture for coordination. All of these has been detailed in a report brief that we published, and feel free to access that at this website. Hopefully you get a sense for the kinds of solutions. These are more structural solutions to manage through the crisis that we're proposing. Hopefully this was value added. The key point I want to emphasize is visual frameworks and right incentives, right metrics is important, and taking a very systematic process approach to addressing this will help us tide through this crisis we all are facing right now. And I'm sure there is light at the end of the tunnel. Thank you so much.